Hello, everyone, and welcome to the panel discussion in the aftermath of COVID-19, the impact on science and research. My name is Crystal, and I am the program assistant for the Northwestern Israel Innovation Project. I'm here to go over a few technical items before we begin the webinar. If you run into any issues during the meeting, please send a chat message and one of us will be able to respond. If you get disconnected, you can reach us at Israel Innovation Project at northwestern.edu. And the webinar is going to be recorded and will be sent to you in a follow-up email. I would now like to introduce Adrian Randolph, who will be giving the opening remarks. Adrian Randolph is the Henry Wade Rogers Professor of the Humanities and Dean of the Weinberg College of Arts and Sciences at Northwestern. He is an art historian focusing on the art and architecture of medieval and Renaissance Italy. As Dean, Professor Randolph collaborates with Weinberg College's roughly 650 faculty members who organize themselves in 26 departments and over 30 interdisciplinary programs. Today, the college enrolls more than half of all Northwestern undergraduates and about 1,400 graduate students. It is an honor to have him join us today. I now pass the mic to you, Adrian. Thank you.
Thanks, Crystal. As Crystal said, I'm Adrian Randolph, and it's with great pleasure that I welcome all participants to this event, the inaugural event of the Israel Innovation Project, a new initiative that helps to strengthen ties between Northwestern and collaborators and interlocutors in Israel. 2020 has obviously been a tumultuous year, forever to be associated with the COVID-19 pandemic. And we've seen both the weaknesses in many of our institutions as well as our strengths. Universities have been in the front lines of adjusting to the necessities of remote teaching, financial reorganization, and the nimble redirection of research, both to address the exigencies of the new strictures under which we must operate, given social distancing, etc., but also to address the virus and its effects. And we've seen astounding adaptability, with scholars making necessary adjustments to their research plans across the arts and humanities, social sciences, and natural and life sciences. Yet no one could deny the negative impact of the pandemic on the projects of so many faculty colleagues, students, and trainees. And these take a particular form in laboratory-based sciences. And today, we're fortunate to have two experts, Professors Benhar and D'Aquila, to offer their thoughts on the impact of science and research in the aftermath of COVID-19. And as we move through this global crisis, we must be both honest with ourselves about the scale of the hurdles we face, as well as the opportunities that the crisis has opened up. And at Northwestern, we try to keep both the present and the future in mind as we seek solutions to the problems before us. Now, today's exchange of ideas is part of a broader set of international and global ties that run through both Northwestern and Tel Aviv University, linking us to a network of ideas that mark the contemporary academy. And we are particularly proud of our ties to Tel Aviv and to Israel, fostering boundary redefining research among a variety of institutions. And this is one of the clear objectives of the Israel Innovation Project, led so ably by Professor Eli Reches, Crown Visiting Professor, whom I wish to thank for all his efforts in putting this program together. I further wish to thank my colleague, Charles Whitaker, Dean of the Medill School of Journalism and Integrated Marketing, who will moderate the discussion. And finally, I'd like to express my gratitude to the Crown family, and in particular to Lester Crown, whose generosity makes possible not just the Israel Innovation Project, but also the Crown Center for Jewish and Israel Studies, and so much more at Northwestern. Now, my own research is historical, and it's clear to me that history demonstrates the dangers of unilateralism and intellectual isolationism. and the advantages, even imperatives, of international collaboration. Programs like this contribute more broadly to ensuring the transmission of knowledge across national borders in ways that are healthy for humanity and our planet. So thank you all for participating in such important endeavors. I'll now pass the mic to Leigh, whose tireless efforts have enhanced Israel studies at Northwestern and our institution's ties to universities in Israel. Leigh is the Crown Visiting Professor, as I mentioned, in Israel Studies at Northwestern, and is an expert on politics in Israel, specifically the politics of Islam and the Arab minorities in Israel. So with that, thank you for attending, and on to Leigh.
How do I get on?
You're on now, Leigh, please.
Yeah. Oh, I don't see myself on the screen. But anyway, should I start?
Yes, please.
Okay. Thank you, Adrian. Good morning, good evening, wherever you are, and welcome to the discussion on the aftermath of the coronavirus pandemic. This is the first public event organized by the Israel Innovation Project, as the Dean said, known by its acronym. And allow me to take a few minutes and briefly introduce IIP, as it is its inaugural event. It is a young institution established merely 2 months ago on September 1st within the Weinberg College of Art and Sciences. I myself am the head of the IIP and member of the Crown Family Center for Jewish and Israel Studies. I also serve as the Israel liaison at the Office of the Vice President for International Relations. The Israel Innovation Project was founded to meet the demand for collaborative work between Northwestern and Israeli academic institutions with a focus on the fields of STEM, science, technology, engineering, and math. We see ourselves as part of Israel Studies, but interpret the field in a broader sense, going beyond the traditional definitions of history, politics, and conflict, so as to include science and technology. The goal of the project is to maintain existing partnership and support them, but concurrently build new academic bridges and exchanges between NU departments, faculty, and graduate students and Israeli university. For example, we intend to focus on such areas as chemistry, computer science, material sciences, biomedic, nanotechnology, neurobiology, renewable energy, quantum physics, and so forth. I should add parenthetically that this is a cross-school enterprise. We will join forces with McCormick School of Engineering, Buffett Institute, Feinberg Medical School, and so forth. In our work, we will strive to raise the interest of the Chicagoland and business community in commercializing the potential and existing future joint research project. Lastly, our plans include additional webinars, discussions, lectures, debates relating not only to science, but also to Israeli society and culture in general. I would like to thank Dean Randall for his continuous support. I would also like to wholeheartedly thank the Crown family, and in particular Lester Crown, for his more than generous gift that enabled the establishment of IIP. And finally, Crystal Falcaro-Hibbs, our program assistant, without whom this webinar and many other activities would not have taken place. Now, allow me, ladies and gentlemen, to introduce the moderator and the discussants. We have gathered a special team for you today. The moderator, as Adrian mentioned, is Professor Charles Whitaker, who is the Dean of the prestigious Medill School of Journalism at Northwestern University. He previously served as the Helen Gurley Brown Professor and Associate Dean of Journalism for the school. Professor Whitaker has received commendations for his work from a number of journalism societies, including the National Association of Black Journalists, Society of Professional Journalists and National Education Writers Association, and more. Charles is the co-author of Magazine Writing, a textbook that examines the magazine industry. We are honored to have you as our moderator today, Charles. Itai Benhar is our first discussant. We have two. Professor Benhar is an expert in the field of antibody engineering and drug discovery and delivery. He published 110 peer-reviewed research and review articles, 12 book chapters, and submitted 19 patent applications. Not least important and most relevant to today's theme, he is the director of the newly established Center for Combating Pandemics at Tel Aviv University. Itai, thank you for joining us and making all the way from Tel Aviv. Dr. Richard Daquila, our second discussant, joins us from Northwestern University Feinberg School of Medicine, where he is the Senior Associate Dean for Clinical and Translational Research and the Howard Taylor Ricketts Professor of Medicine. Concurrently, he is the Senior Director of Northwestern University Clinical and Translational Science Institute, known by the acronym NUCATS, which plays such a critical role in advancing research. Professor Daquila is a prominent expert in the fields of HIV/AIDS prevention and treatment, and a fellow of the Infectious Disease Society of America. He's the author and co-author of more than 150 peer-reviewed research publications. We know, Richard, how busy you are with all these positions, so a special thank you goes to you. At this point, I hand the mic to you, Charles. Thank you all.
Thank you so much, Ellie. And Itai and Richard, thank you for joining us. It's such an honor and a privilege for me to be in conversation with two such distinguished scholars and scientists. Thank you. I know this is billed as a conversation about life after COVID, but the news of the day is so remarkable that I think we have to talk about the present for just a little bit. Yesterday, we had the rollout of the first vaccine in the UK. We have 5 vaccines in development right now. But that news is sort of tempered by the fact that we're in the midst of yet another surge. Intensive care beds in the United States are nearing capacity. We're in lockdown in several cities across the globe. So I'd like you both to both talk about where we are, but gaze into your crystal balls a bit and give us a sense of what we might expect in the next 6 to 8 months or so. Itai, can I start with you?
By all means. So thank you, Adrian. Thank you, Ellie, for the kind introduction, and Charles for moderating this discussion. So obviously, the news of today is the initiation of vaccination program, actually yesterday in the UK. As a matter of fact, a few doses of the Pfizer vaccine were flown into Israel today, so we'll soon start vaccinating as well. However, it's going to take, well, I estimate about a year or so before we reach the level of coverage of the population that, in my opinion, COVID-19, a disease of the past in terms of a life-changing event. So it's, in my humble opinion, it's going to be around still, but since most of the population will be immune by vaccination, it will not be as disturbing as it currently is or has been for the past year or so. Having said that, I personally have a concern shared by others about the acceptance by the general public or the willingness to get vaccinated. People are worried, anxious, intimidated by fake news or unrealistic data that is being released in social media and so about the potential harmful effects of a vaccine. And even about the fact that we don't really know if this is going to be like a seasonal vaccine that we'll have to get every year like it is with the flu, or it's going to have a longer protective effect. So for that prediction of mine to materialize, meaning that we'll all go back to our normal lives almost, there will be, of course, a long ripple to that actually global disaster. The public has to be compliant. I personally expect the leaders of society to give a personal example, step forward and convince everyone that it's not only for your own protection, it's your responsibility as a member of a society to stop the spread of this disease. And I'm sure we'll talk more about it.
Absolutely. Richard, where are we, and where do you think we'll be in 6 to 8 months?
Yeah, thank you, Charles, for that good question to start us off, and my thanks to Adrian and Ellie for pulling all this together. I agree with Itai. I just want to point out that what he said about the public needing to accept the vaccine, both for their own good and to protect others, applies equally to masks. And we've had limited success there. I think one of the issues that has been a problem and will continue to be a problem is that a large proportion of the public, at least in the United States, has trouble accepting science these days. And I don't fully understand it, but I think that's going to be something important that we'll have to improve on in the next year. I think as the vaccines roll out, the other thing I'm a little worried about is that people will expect magical things to happen. I got the vaccine, I can take my mask off and I can go to the restaurant. And you can't, because the trials so far have only told us that the vaccine prevents illness from the virus. We don't know if it will completely stop asymptomatic infections from occurring. Now, there are going to be trials that will answer that question. They are going to be starting in January once the vaccine is starting to roll out. So we will get answers to that. And I'm hopeful that in 6 months, maybe we can, once we get vaccinated, feel comfortable taking off our masks. But as a physician, I will be getting vaccinated near the front of the line somewhere, but I'm still going to be wearing a mask when I'm outside of my home because I won't be certain that I don't have an asymptomatic infection, and I certainly don't want to spread it to my patients or anyone else.
Were both or either of you surprised by the pace at which the vaccines have been developed? Richard, you're nodding.
Yeah, yes and no. I'll jump in. You know, and this is something Itai probably knows more intimately than I do. You know, our advances in understanding antibodies and the immune system have been astonishing over the past decade or two. And I think we were well prepared for this. And the mRNA technology that's behind the Pfizer and Moderna vaccines has been, you know, in development for, I don't know, probably a decade. I know most about it since 2015. So we were prepared, but I was still astonished because the fastest any vaccine's ever been developed is 2 to 4 years. And it, you know, also is astonishing if the data that we see in press releases turns out to be 100% true. It's astonishing how effective they are. because many vaccines are between 50 and 90% effective, not more than 90% effective.
Itai, were you surprised?
Well, as a scientist, and in some way, I'm also an immunologist. I was not, because, as Richard pointed out, the technology was there. The tools were there. What is obviously astonishing is that we had the first vaccine near approval, already approved at the UK, within less than a year since the sequence of the genome of the virus became available. Because actually, I think that it was a matter of less than a month between the sequence of the initial virus from China was published to the RNA molecules that are part of the Moderna vaccine and the Pfizer vaccine were already synthesized and encapsulated into proprietary lipid composition that is the envelope used for their delivery. We should give credit to the regulatory agencies that have become more flexible. They have realized, perhaps more than the public or even the governments have, that this is really a crisis situation, and desperate times called for desperate means. So as soon as it was clear that we don't put masses of people at risk by administering them with these several vaccines that are leading now the efforts for approval, there was a green light and a go ahead, with caution, of course, but to move forward with vaccination, which I think is great. I mean, some credit should go to the leadership, the state leaderships as well, because they also had to exercise some flexibility in thinking and putting anxieties aside, because really we need to get back to our lives. And so without vaccination, that's not going to happen.
So in terms of, oh, go ahead, Richard.
I just want to make one point in follow-up. The governments, I think, deserve credit for investing tremendous amounts of money in the at-risk manufacturing of the vaccines. That took me a little by surprise. We've never done anything like that. But indeed, it was absolutely the right thing to do.
Given the requirements for storing this vaccine, do we have the public health infrastructure to administer it widespread, for widespread administration, both domestically here in the US, but also globally? Or is that going to be difficult? Is that going to be a challenge? Itai?
Well, so far, only the Pfizer vaccine was declared as one that should be stored at -80 degrees centigrade, which is the deep freezers we have in our special labs, not very commonly available. All the other vaccines should be stored at -20, which is the temperature of your domestic freezer. So that's not a big deal. The cold shipment chains are also in place to assure delivery and storage at the appropriate temperature. So that's not going to be an issue for westernized countries. Now, for the third world countries, that's a different issue. There is no cold storage. There is sometimes no stable supply of electricity, and solutions for that are not yet in place. So yes, so this is a concern for a large part of the global society, which people should come up with solutions for.
Richard, thoughts?
I agree. I think the deep freezers are plentiful in urbanized areas. I expect even in the US, though, it will be a problem to maintain that cold chain in rural settings. So what I expect to see is that once we get a second or a third vaccine approved, that the distribution for the Pfizer vaccine will be to the more urban areas that have the -80 freezers, and the others will be sent to the more rural places. I think the global issue is a really big one, because all of the vaccines that are currently in development required some cold chain, even if it's refrigerator temperatures for some of the ones that are still in trials. I think we could do it. I think there's been experience with flu vaccines, with the Ebola vaccine, which was ready to roll out before it wasn't needed, thankfully. So I think it can and will be done. But I also think we have to keep pushing for development of a vaccine that would not require cold chain and be cheaper, because that's the ultimate solution for many of the countries in the world. And there are some vaccines like that are in development. Some of them are in phase 2 trials now. So hopefully in months, some of those will work as well.
You both talked about, the long-term development of vaccines, and that we have been sort of working on this for up to a decade. Then what went wrong in terms of preparing for COVID-19? I mean, why were we not that? We've had experience with other viruses. We've had not a pandemic that was this widespread, but what were the failures here that, but again, globally and domestically, that prevented us from at least anticipating and being better prepared to thwart this and keep us from the position that we're in right now? Itai?
So when COVID-19 began, there was little known about it. It's different from other coronaviruses we are more familiar with. It's because it's very contagious. It's not as lethal as SARS or MERS that were 20 or 10 years ago, but it is very contagious. You could compare it to swine flu or some other pandemics that in some cases were also associated with high mortality. Fortunately for us, statistically, we are not in that situation. So we don't see half of the world population, God forbid, dying from a pandemic, but still there was little knowledge among the medical professionals even. So let alone the policy makers. That confusion led to a lot of trial and error in how to handle the disease. So masks and social distancing were in place pretty soon, although masks that Richard reminded us that we still need to wear them, which is very true, until we're out of the woods. There was a debate initially. The World Health Organization didn't mandate wearing masks at the first 2 months, I believe, before it was obvious that social distancing and wearing masks is actually perhaps the best way to defend yourself from infection. So the confusion by the opinion leaders and policymakers was largely responsible for, I wouldn't say failures, but limited success. And that was combined with, on one hand, a huge hype about the severeness of the situation relayed by media and social media, a lot of rumors, misinformation, and so that led really to a lot of confusion. And lastly, a difference between different parts of the world. So it was easier to control the virus in, well, I should say, less democratic countries, because the people are more disciplined there, or I mean, free will or less free will. But in the US, as it is in Israel, people are reluctant to be locked up in their homes, to wear masks, to stop going to restaurants, supermarkets, and so on. So it wasn't easy. It wasn't easy to implement measures that would limit the spread of the disease.
Richard?
Yeah, I'd like to confess my own personal mistake. At the very outset, people were asking me about masks. Should I wear masks? And my understanding as a physician and a virologist was that the mask is worn to protect you. And these flimsy surgical masks are not good enough to really do that. When we're in the hospital and we're worried about tuberculosis, we wear an N95 mask because that filters out 95% of the particles. But if you're only filtering out 30 or 50%, which is all a surgical mask does, you're still going to be exposed. So I said, well, we need the limited supply of N95s for the hospital workers. So we can't, in the general public, all wear them. So don't bother. It's not going to work. It was only later that we learned that the big reason why this virus is more contagious than SARS-1 or MERS is that people start shedding it from their nose and their mouth before they have any symptoms. With those earlier viruses, they were most contagious only after they developed symptoms, only after they went to the hospital. And the masks were used by the hospital workers to protect themselves. By the time the patient was spreading the virus, they were already removed from the community and from their household. But, you know, we learned, and unfortunately, in the sort of polarized world where we live, the attitude of scientists that, you know, we have hypotheses, we test them, we learn from our mistakes, is not the one the general public has. So they saw this as either a lie, another bit of misinformation, or just a mistake that is unforgivable. And I think that has led to a large, that contributes a lot to the reluctance of people to accept masks, because, you know, we were wrong in the beginning. Why should they trust us now when we changed our mind and said wear them?
Don't you think that also will contribute to some mistrust of the vaccine? I mean, people are also feeling very, very skeptical about the efficacy of the vaccine because they say you've been wrong before. And how do we begin to combat that?
Yeah, I'm going to jump right in if you don't mind, Itai, because I think I really think this is going to be critical. And again, the hype has to be toned down because we don't know a lot and we don't know what we don't know. So we'll have to learn about the vaccine. Just this morning, I'm hearing reports that some of the people vaccinated in the UK yesterday had serious reactions, allergic type reactions. So that's new. We haven't heard about that. We need to find out more about that. And I think we need to have more straightforward messaging that these look really good, but when we scale them up from 30 or 40,000 people to millions, hundreds of millions of people, we will find out things that we don't know today. And there probably will be some side effects. So one of the things that I'm working on with colleagues here in Chicago is developing what we're starting to call a vaccine corps to try to recruit people from the community. And we're talking about, you know, 100,000 people, not 100, who could be taught about vaccines and then become trusted messengers and go back to their communities, to their churches and schools, and help to dispel myths and be an example of understanding how to adapt with the vaccine.
Itai, you mentioned the success of compliance in autocratic or less democratic countries as opposed to democratic countries. One of our listeners said, you know, you have New Zealand, which has had been relatively successful at getting compliance. So is it more an issue of the autocratic nature of countries or just the fraught politics of, say, the US and Israel?
Well, it certainly could be that, but perhaps, I mean, people in different parts of the world are based due to cultural differences more or less prone to be disciplined. And Israel is a very undisciplined nation. I don't know relatively to US to give percentages, but it is difficult. So in states in Europe, so you could see differences between different nations that are basic or have been basically exposed to the same level. I mean, the virus does not obey national boundaries. It was around, but you saw drastically different statistics of infection, of serious illness, of death in different countries, and that was basically the behavior of the population. Now, on top of that, you are right, there are political issues and where clear messages were not conveyed on a regular basis to the public for various reasons. The public became reluctant. So yes, it very well may be that same reluctance we'll see when people will be offered to get vaccinated. I said in the beginning that I'm concerned about such a chance, but yes, as science in general is, to our dismay, not well respected in many parts of the world for many reasons. So yes, so people are suspicious. For example, we had a conspiracy plot about Generation 5 chips of cell phones implanted through vaccination with an RNA vaccine, or an RNA vaccine causing permanent alterations of your genome makeup and so on. So really very clear statements should be made by leaders, as well as, I have to emphasize, personal examples. So the leaders of society should step up and be the first ones to get vaccinated, not for their own protection, but to give a good example to the public at large.
I'm going to ask you both to sort of criticize my world, the media world, because there is so much misinformation and disinformation out there that has contributed to the distrust of science. I know you're not public opinion experts necessarily, but what can or should we do? How do we get the general public, how do we better inform them, but also how do we get them to trust science? Again, you sort of touched on this, Itai. There are these tremendous conspiracy theories that are floating out on the web. And you know, one of the benefits of the digital age is that the barriers to publishing have been obliterated, and so anyone can publish. But that's also one of the great detriments of the digital age as well, because there is so much junk science out there. What do we do about that? Do you have any ideas, any thoughts? Either of you?
Well, so unfortunately, as you said, I'm not an expert in media science, but the relative disrespect for scientists and science has been developed for a long time, and that was partially, in Israel at least, driven by politics, painting or displaying, claiming the scientists are snobs that are disconnected from the public. They are not in contact with reality, they are privileged and so on. And this conception really it's going to take a long time. If it's even solvable, I don't know. I mean, it took a long time to erode the prestige scientists once had, and it's going to take decades perhaps, if it's even manageable. So actually, the responsibility moves away from scientists to to politicians, to honest politicians, and to medical professionals, well, not, although many of them are scientists, since they are practicing physicians, they still have a lot of prestige. So it's up to them to come up and convey the messages that the public should be aware of. And the scientists, unfortunately, have to stay in the background. We are conveying messages to the leadership through other channels, but we are not coming forward because that's actually making more antagonism than being conducive to progress.
Richard, what are your
I
thoughts?
agree with Itai. I think the big issue is distrust of elites and a very anti-elitist sentiment. I think political leadership has to set a good example. And I hope I'm not offending anyone by saying in the US, I don't think we've seen that. I'm hopeful it'll improve. One of the problems in the US has been that the CDC has been pretty silent. And normally they would be in the lead in communicating through established public health circles, guidance and knowledge and keeping everybody up to date. I am hopeful that under new leadership, which by the way is an infectious disease doctor who's outstanding, if she's confirmed, it will return to that. And I think that'll help, but it's important when the government and our public health authorities are conveying the messages that they not be elitist. And I think that's still going to be a challenge. And, you know, I hope, Charles, that your colleagues in the media can help us with that. You know, one of my colleagues here about 15 years ago did an anti-smoking campaign and was on every news program in the city every night for months. And they kept track of the progress being made and people stopping smoking. I think we need things like that. I think there needs to be better communication, not only from the top, but from community leaders who are more trusted. And a lot of it might be boring and it's not a big soundbite. And when you get me talking, I have all kinds of qualifications. Well, maybe it'll work, maybe it won't. But I think we have to be more honest.
I will say the difficulty, however, in the current media environment is that we retreat to our echo chambers and there is no consensus about truth anymore. And so depending upon where you get your news, you get a very different version of events. And so there's without a consensus, it's hard to build cooperation and trust in media. We tend to trust those media outlets that confirm our already held beliefs. And so that's the challenge of the current media environment. That's all my editorializing for the day. Has the pandemic increased or thwarted international scientific cooperation? Has it been a boon to cooperation? Has it decreased cooperation? Has the race for the vaccine just been a singular pursuit by various companies and or countries, or are scientists actually coming together to work on this? Itai?
So
internationally speaking.
yeah, so especially in the beginning of COVID-19, there was a boost in international collaboration, free exchange of data, and not going through the patent office for every new invention or finding, sharing of reagents and so on. That was really, really high at the time. I would think that by now, scientifically speaking, we are back to normal. So the level of international collaboration that is focused on COVID research is pretty much the same as it was in, let's say, virology, immunology, and so on, as it was a little than a year ago. But in general, funds have been funneled to support COVID-19 focused research. So that's kind of a flourish. I mean, virology has been considered a profession, a medical or an academic profession of the past, so to speak. I mean, you could not, or it was difficult until 2 years ago to get a position in academia if you are a classical virologist, because you know the HIV. Sorry, Richard, but the HIV has not made tremendous progress. I mean, the HIV-focused research did not bring miracles since the invention of the drug cocktail for treating patients. Hepatitis C did make progress, but basically people that have been studying viruses were kind of left behind or out of the limelight. So this has changed. The same is true for immunology. Epidemiology came now to the forefront of the medical professions because statistics based on large sample sizes are now becoming more and more important. So I would say that there has been an increase in net research activity. You might have thought otherwise, and we would have thought otherwise, and we will probably discuss the direct effect of COVID on the actual research that is being conducted because of the lockdowns and so on. But yes, there has been a kind of a revival or a renaissance in some knowledge areas in academia, which I'm enjoying even personally because I'm involved in these type of studies.
Richard, how do you feel about international cooperation?
Well, I'll debate Itai about HIV advances another time.
I thought you might.
But I do think we have seen just in the past few months a renewed interest in careers in infectious diseases. So we just went through an application season for fellows, and we had more applicants than in, I don't know, more than a decade. So I think Itai's right about that. I want to go back to a couple of the international issues, though, because the one that alarms me has been in the news in the past week. And there's this tendency to be nationalistic about the vaccines that I think could become a real problem. We're all in this together, for sure. And that was, very apparent at the start. That's why there was such international collaboration at the start. And we just have to keep from being nationalistic. The other thing that I'm sort of worried about, and this is unrelated to COVID, but the tensions between China and the US, I think that is impacting how well US scientists can cooperate and collaborate with Chinese scientists. To me, knowledge is totally global, and we have to take advantage of every brilliant person in the world. So I hope we can get past that problem too.
On a more personal note, how has the pandemic and the lockdown affected your work individually? How has it affected your labs and the research that you're doing? Itai?
So in Israel, lockdown was actually less severe than in most parts of the US. I don't know about the state of Illinois, but so we had so far 2 lockdowns. One was in April, one was in September. Now, so the lockdown did affect academia because we were not allowed to come to campus, but through clever administration. So the total lockdown was really for just a few days. And then they said, well, 30%. So then the research universities were defined as an important resource. So 30% of the staff were allowed to come on campus. So all the auxiliary staff worked from home. Now, almost all the scientists and students of humanities, art, and so on worked from home, but experimentalists could come. So if you did the math on a campus level, so we could come and carry out most of our research. there was some damage because you were not allowed for the time to start new mouse colonies, people that do animal experiments. So there were some limitations, but again, so people that are willing worked shifts, like half a day, and then the other group comes on the other half. So creative management of academic activity did allow most of Israeli academia to continue working on almost on normal level. Now teaching is a different story, but we'll probably go to that later.
Richard, how about your work?
It was a little different. Here in Illinois, we were under a stay-at-home order starting in March. And all activities turned to Zoom, and we had a big emphasis on writing manuscripts. And actually, I got more papers done in March and April than I had in the prior year. And the return to the workplace was slow and phased in so that social distancing could be maintained. So we didn't really get back to full laboratory activities until end of July. And we're still working sort of on shifts and making sure that the space is not overpopulated. But we're back to doing experiments, and it's pretty much back to normal. I do think the Zoom thing is here to stay because many things, a lot of long distance collaborations are actually working much better than than having to fly somewhere and waste time. So in some ways, I think we're gonna stick with some hybrid scientific workplace with partly remote and partly in person.
I think that's true for the world. I think we will have a hybrid world going forward, no question about it.
Yeah, if I could just add.
Yes, go ahead.
Show a small funny anecdote. So in the beginning, we were really anxious. It was not clear the lockdown, for how long are we going to be restricted from coming to work and so on. So I was telling my friends that with the limited ability to carry out research, it would be really funny if in a year's time we'll realize that our productivity has gone up. So Richard has submitted more manuscripts than usual, but so I don't know if that really happened, but yes. So actually the anxiety was really a little exaggerated, considering what the reality then that took over, that allowed us to carry out research at the almost normal level.
I have no doubt that many social scientists will be studying this, and many papers will be written about the effects of COVID on productivity in many, many realms. So, in both of your estimation, has COVID research sort of so dominated the public and scientific imagination and attention that it's crowding out other things? What are we not focusing on that we could or should be focusing on? Well, is that a true premise? Yeah, is it crowding out things and keeping us from focusing on things that we could or should be focusing on? Itai?
Well, I personally believe it's marginal. Again, I'm very good at telling stories, but so people, so you only have 24 hours a day to work, and people did, or many people diverted efforts towards the COVID-focused research, so that came at the expense of other activities. And I was sitting in many grant evaluation committees looking at people proposing to do COVID-focused research, and I really was not happy with proposal that said, we have this and that technology, with a little effort, it can be converted to COVID. But some people did some shifts in the focus of the research, because, and that was not mainly, I mean, again, in my opinion, was not driven by scientific curiosity, but from an ambition or willingness to contribute to society. We realize there is a real crisis. It's actually, it's a war out there, and we should do our best to contribute. So people did sort of sign up, came up with making efforts to do activities. Again, it was more prominent in the beginning than it is now, but it's not, in that sense, it's not normal. So there was no COVID research, of course, when there was no COVID, but yes, we see it, and it being carried out and communicated, of course, much more than let's say virus-based research was 1 year ago.
Yeah, Richard.
Well, a little different for me. So our HIV research continues, but I have to say almost all the people in the US working on COVID, maybe I'm exaggerating, a lot of them have come from HIV research.
Really?
And now there's a huge amount of time being spent on vaccine research, and that's gonna keep going for a while. So I think we are a little bit drawn away from other viruses, but I actually think that's okay.
Is that a good thing?
I think it's we don't know yet the full impact on HIV, but to Itai's earlier point, you know, maybe it's good for us to sort of rethink what we're doing. And I want to make the point, though, that I don't want us to abandon the COVID teamwork and feeling like we're all working for the right, just cause, because the next pandemic is around the corner. And I think one lesson that we have to take from all of this is not to ignore that and to keep working on pandemic preparedness, because it might be another retrovirus, it might be another coronavirus, it might be who knows what.
Oh, go ahead, Itai.
No, I said absolutely. That's now I can add to that again, the thinking about how science should be carried out during a time of crisis or emergency has also increased. Actually, well, I've been seeing this in the way that FDA has been evaluating and approving therapies, not during COVID, a few years ago, when new therapies for cancer came out and people were dying on treatment. I'm talking about CAR T cells, if you know what I mean. So people are giving white blood cells to fight their cancer, and it's a magic treatment. It saves lives, but people are dying on treatment. Right. Now, when I started working on advanced therapeutics almost 30 years ago, if a single person died during a clinical trial, it was this. I mean, the whole business was stopped for like a decade. And the other day I read that I think it's in the UK, Imperial College now is initiating a challenge study. Now, what is a challenge study? So if you bear with me, so basically when the clinical trials for the COVID vaccines began, so again, Moderna, Pfizer, and the others, AstraZeneca, they vaccinated some 50 or 90,000 individuals, so half of them got a placebo and so on. But then they waited for infection to occur spontaneously by just random exposure. So the number of infected individuals was relatively small. Now, I'd say I, as a scientist, would volunteer to get vaccinated and then challenge with the live virus. But that's me. I'm maybe not normal. But what these scientists at Imperial College are going to do is a challenge study that they are going to infect healthy people with live COVID to determine the minimal infectious dose that is required to start disease, not a severe one, hopefully, but a disease with volunteers. Now, since the 1950s, when when I think the people that were called them retarded in the US. There was a very infamous study where they were, I think, vaccinated with something that is highly unethical, of course, today's standards. It was unethical back then, of course, too. So, but exposing intentionally healthy people to a pathogen, I mean, I'm actually positive about it, but that's really unheard of. So that's progress. That's really taking the horn by the boots. I don't know. I mean, I'm curious to see if other countries will follow suit, because that can also bring a lot of valuable information about the efficacy of vaccines. Because I mean, that's not, again, it's not a curiosity-driven research to see how much virus is required, but then you can really challenge people post-vaccination and see a lot of data coming in about the efficacy. It's important, of course, but that's really bold, and that's scientific and regulatory progress in times of a crisis, which is.
Itai, I have to jump in and disagree. I think it's unethical still. I think the only way a challenge study can be done ethically is if we have medications or treatments that can prevent severe illness if an infection occurs. And we don't have that yet. I mean, that's actually one of my complaints about the emphasis on vaccine research. It has, if anything, taken away from development of therapeutics for COVID-19. And so I think those challenge studies would be great once we have developed, using structural biology, a protease inhibitor or something else that is actually going to shut down the virus and keep it from killing people. But we don't have that today.
Well, you're right, of course. So, well, the study design is to use only people between the ages of 20 and 30. They're well informed. Yes, but basically, yes. I mean,
that makes it okay.
normal times, that's a highly unethical study. Because if someone gets seriously ill, there's little that even the most advanced medical care can do for some of these people. Some of them may die.
Yeah.
So back to my point, though, is again the focus on virology, immunology, crowding out other things? Is it making it difficult to get funding, for example, Richard, for HIV research now? I mean, are we so focused on COVID that other things are just falling by the wayside?
No, I don't think so. You know, I was just on 2 review panels in the past couple of weeks, and people are still submitting grants. They're getting funded. You know, the NIH, at least in the US, has not diverted money away from other fields. So I think all that is, it's still going on.
Yeah.
Yeah, I agree. So the same in Israel. So all the regularly funding programs, which usually run in annual circles, they are just, I mean, they're done regularly. Some deadlines have been pushed a few weeks back to allow times to recover from a lockdown, but that's marginal. So the number of funding programs and the amount of funding has not dwindled.
Okay.
The COVID-focused research came from additional funds.
So conversely, are we seeing, Richard, you talked about, you know, the rise in the number of fellows that you're seeing. Are we seeing a heightened interest in science again? And, you know, could this be the launch of another Sputnik type resurgence in interest in science? You know, Sputnik sort of propelled the U.S. into the space race and more emphasis on science education. Could this be the start or the genesis of something like that?
Gee, I hope so. You know, I don't interact with undergraduates, so I'd be very curious to hear from you, Charles, or you know, anyone else who does teach undergraduates. whether that's getting through to them. I mean, my hope would be that it's going to be the youngest people who get most excited about science now. So we have a long pipeline, if you will.
Itai, any thoughts?
Well, yeah, it's not a simple answer, but we had registration for undergraduate studies in the life sciences, mostly in medicine, almost doubled from last year to this year.
Wow.
Now, but I don't think that's all owing to more interest in science, but the reality is that that Israeli youngsters, when they finish their mandatory service in the army, they usually go to work for a year or so, and then they use the money for international travel for another year or so. That's before they join colleges or universities. Now, when COVID broke out, there was a lot of unemployment. All these temporary positions were not existent anymore, and international travel was not possible. Right. So the young people didn't have much to do. They went to the universities instead. In the long run, I do expect, however, that they will be, I mean, since now science and medicine, and not only that, I mean, all the other research approaches that are looking onto pandemics and epidemics and so on are getting a lot of exposure. I do think that there will be an increase in enrollment to undergraduate studies across the board in Israel.
So our time is almost up, but for my last question, I'm going to go back to the beginning because you both kind of skirted this. I want you to look into your crystal balls and tell me what the world is going to look like this time next year. What can we expect? Richard?
Well, I think this time next year, we will be approaching the full coverage of vaccines that we need. And I think we will be starting to get back to normal. I don't know that we will be completely there, but I anticipate that there will be some public venues that are open, maybe not full capacity at restaurants, maybe half capacity in a movie theater, but I expect we're going to be getting back to normal.
Is that?
Yes, I agree. Actually, I made a prediction. Again, it's a non-professional prediction, but and based mostly on public willingness to be vaccinated. But I hope that that's going to happen. So I predict that by the end of December next year, so that's 13 months from, no, actually less than 30 months from now, we'll be almost back to normal in terms of the job market, of the healthcare system, of the economy, not fully recovered, but well on the way to do that. So as I said in the beginning of our discussion this evening, so COVID is, I don't expect it to be a disturbing event to the extent it is right now. By the way, a way to catalyze that is by offering the people that do get vaccinated, I mean, motivations. So again, being democracies, we cannot force anyone to get vaccinated. But we say, hey, you did get vaccinated, you cannot do international travel. If you are a preschool teacher, you cannot be exposed to children. So using, I mean, a carrot and stick the system, so to speak, more rewarding the vaccinated ones than punishing the unwilling ones, I think we'll be able to make progress.
COVID in some way, in some strain, here with us to stay?
Yes.
Yeah.
All right. Well, that's a sobering thought. Yeah, Richard, you were going to say.
Well, I was just going to say that we've already seen it spread to other animals. It's still in bats. It can come out again in a slightly different form from bats. Now we also have to worry about mink. So.
Well, the Danes put them all down, I believe, but yeah, but.
Just one country so far.
Yeah. I don't know if there are that many minks elsewhere, but yeah, but there is, yeah, there are reservoirs that are not in humans. So as Richard said earlier, we can be looking at a different pandemic or a similar related pandemic really soon, and preparedness is really of the essence.
Wait, I'm sorry, so it was the last question, but next last question. What have we learned now that will help us deal with this better going forward?
Oh, I think a lot. So we know a target in coronaviruses for vaccines. I think we probably will develop some medicines before the next one hits. So at least for coronaviruses, I think we will be much better prepared. We also learned all the right public health mitigation measures, which, as we said before, a lot of us were either skeptical of or unaware of in the beginning of this.
Itai.
Yeah, so in terms of governments, preparedness should be in the form of having ready programs to deal with each possible scenario, if that's even possible. But yes, so because of the magnitude of this pandemic and the public awareness and anxieties, I think we may be already well advised how to be better prepared for the next time we have such an occurrence.
And is mask wearing here to stay, and will we never shake hands again?
Well, so I don't know. It's interesting. So the medical professionals were very worried about what's going to happen in the winter in Israel when we have flu combined with COVID, similar symptoms, so on. Now, we learned about from the southern hemisphere, the social distancing and mask wearing has brought the number of infections by seasonal flu to about a third. So we don't have statistics here, but I expect it to be similar. People in the Far East, in Japan, I think in Southern Korea, they walk around wearing masks. I mean, the same is true for Beijing, but that's because of air pollution, not for infectious diseases. But that may not be a totally bad idea to walk around wearing a mask. I mean, I could do that. I could get used to it.
Yeah, I agree, but I do think we're going to go back to shaking hands and giving hugs.
Yeah, hugging and so on, right?
Okay. My 96-year-old aunt will be happy to hear that. Thank you both very much. I really enjoyed the conversation. Thank you for putting up with my questions and fielding them. It was really enlightening, and I hope everyone else enjoyed it as well. Thank you. Ellie, do I turn it back to you? Or Crystal?
Ellie, can you unmute your mic and your camera, please?
I'm trying to. Here, I've done it. I've done it. Okay. Am I okay now?
Your mic on, but that's okay.
Your camera is still off.
Well, I'm trying to do that.
There you go.
Now I'm good. Okay. What I wanted to say is that had we been sitting face to face or together, I would have shaken your hands. Unfortunately, I can't do that. Anyways, what I want to say that maybe I'm exaggerating, but this was an extraordinary interesting session. And thank you for a fascinating exchange, which exposed us to the intricacies of the battle against COVID-19. This was a discussion which introduced us to the present situation and to the prospects of the future. Indeed, thank you very much. I would also like to thank our listeners who were with us. We have to change the language. And also ask you to follow us on Facebook at this point and in our upcoming webinar. Hope to see you soon. Thank you very much.
Thanks for having me on, guys.
Thanks. Take care.
It was a pleasure. Bye-bye.
Pleasure too.